Sleep disruption after knee replacement is incredibly common, and it can be one of the most frustrating parts of healing. Not because something is going wrong, but because it feels relentless. You're tired, your body is healing, and rest feels just out of reach. Are you ready to get back to what you love after knee replacement? The Total Knee Success Podcast is your trusted guide with practical tips, evidence-based strategies, and no fluff. It's not personal medical advice, just solid education to help you manage pain, regain mobility, and get back to living the life you love. Let's dive in. Hi, I'm Michelle, and welcome back to the Total Knee Success Podcast. If you're preparing for a knee replacement or you're already in the early weeks after surgery, there's a good chance sleep has crossed your mind maybe more than once, sometimes long before pain or physical therapy ever does. I hear it from patients all the time. They prepare for surgery, line up help at home, plan their rehab, and still find themselves lying awake at night thinking, why didn't anyone tell me sleep might be this hard? Sleep disruption after knee replacement is incredibly common, and it can be one of the most frustrating parts of healing. Not because something is going wrong, but because it feels relentless. You're tired, your body is healing, and rest feels just out of reach. By the end of this episode, you'll understand why sleep often feels so different after knee replacement, which sleep positions tend to support healing instead of fighting against it, and how to take pressure off yourself when nights don't go the way you'd hoped. Today I want to talk about sleep positions after knee replacement, what actually helps, what tends to make things harder, and why your body behaves the way it does during healing. This isn't about promising perfect sleep. It's about understanding what happens in your body so you can make choices that support rest instead of struggling against it. One of the most common assumptions people make is that there must be a single correct sleep position after surgery. People are often told to sleep on their back with their leg perfectly straight, sometimes with pillows stacked just so, and they assume that if they move at night, they've done something wrong. The truth is more flexible than that. Early after surgery, your knee is swollen, sensitive, and adjusting to a major structural change. Swelling alone increases pressure in the joint and the surrounding tissues, which can make certain positions uncomfortable even if they're technically safe. Add in changes to circulation, nervous system sensitivity, and pain medication schedules, and sleep disruption becomes very understandable. Let's start with back sleeping, because it's the most commonly recommended position. Sleeping on your back allows the knee to rest in a more neutral position and makes it easier to manage swelling. Many people find it helpful early on, especially in the first couple of weeks. What often causes trouble is forcing the knee to be perfectly straight at night. In fact, the American Physical Therapy Association's clinical practice guideline on physical therapist management after total knee arthroplasty, boy, that was a mouthful, notes that in the first 7 days after surgery, resting with the knee in some degree of flexion, just some slight flexion, may be taught as a strategy to reduce blood loss and swelling. The bigger point here is that early comfort and swelling control really matter, and rigid all-night perfect extension rules usually create more stress than benefit. Prolonged rigid positions can increase discomfort, especially if your knee naturally rests with a small amount of bend early in healing. Instead of forcing extension, think in terms of support, a pillow under the calf, and generally not directly under the knee, because that will tend to make your knee flex a lot more. But putting one under the calf can provide comfort while still allowing gravity to assist a little bit with knee extension. If back sleeping works for you, that's great. If it doesn't, that doesn't mean your body won't heal the way it should. Side sleeping is another common question, and one that creates a lot of anxiety. Many people are told they can never sleep on their side or that it's unsafe. In reality, side sleeping is often possible once comfort allows, with a few important considerations. If you're lying on your non-surgical side, placing a pillow or cushion between your legs can help keep the surgical leg supported in a neutral alignment and prevent the lower leg from torquing at the knee. Supporting the entire leg, not just the thigh, helps maintain neutral alignment and often makes side sleeping a little more comfortable. This reduces strain on the knee and the hip and makes it a little more tolerable. Lying on the surgical side is a bit more variable. Some people find it very uncomfortable for several weeks due to incision sensitivity and swelling, while others tolerate it earlier. There's no prize for doing it sooner. Comfort and tissue healing dictate timing, not toughness. If you try and it clearly hurts, that's useful information. Listen to your body. Give it another week or two and try again. Your body's likely just not ready yet. Another position that comes up from time to time is sleeping on your stomach. I generally discourage this after a knee replacement. When you're lying on your stomach, there's direct pressure on the front of the knee, right where your incision and sensitive tissues are healing, which can increase discomfort. It's also a little risky if you have a very fresh healing incision. You don't want to disrupt that healing skin. It also tends to place your knee in a position that's harder to control and may add strain if you stay there for long periods. Beyond the knee itself, stomach sleeping often requires sustained rotation of the neck and extension through the low back, which really can create issues in those areas, especially when your body is already adapting to a recent surgery. Some people strongly prefer sleeping on their stomach, and if that's you, it doesn't mean you've done anything wrong, but early on, it's usually not the most supportive position for your knee or the rest of your body. Most people do better really just waiting until the tissues are less sensitive before trying it again. What's important is avoiding positions that create twisting or prolonged pressure on the knee. Your body is usually very good at telling you when something isn't working. Waking up sore or stiff doesn't automatically mean harm, but persistent discomfort is a signal to adjust. Some people find sleeping in a recliner extremely comfortable in the early days after surgery, and for many, it's the only way they're able to get any rest at first. Recliners can be especially helpful when getting in and out of bed feels difficult or when swelling and discomfort make lying flat hard to tolerate. The key is to think of the recliner as a temporary tool rather than a long-term solution. As you're able, it's generally helpful to transition back to a bed so your knee can spend more time in varied positions, including a more neutral alignment. Sleeping in a recliner long-term isn't usually recommended unless you have other medical reasons for doing so. If you use a recliner temporarily, try to balance it with time during the day when your knee is supported in a more neutral position. Clinical practice guidelines for physical therapist management after total knee arthroplasty emphasize restoring knee extension through active movement and positioning across the day rather than prolonged static postures. Because extended time in sustained flexion can contribute to stiffness and make comfortable extension harder later on. And remember, this isn't about perfection. It's about variety and balance. Beyond position, swelling and pain levels can influence how comfortable sleep feels, especially later in the day. Managing swelling early in the evening and timing pain medication appropriately, in coordination with your healthcare team, of course, can make nights a little more tolerable. But these topics deserve their own focused discussion. If you want a deeper dive into sleep strategies beyond positioning, Episode 3 of the Total Knee Success podcast walks you through some of this in more detail. Another common misconception is that poor sleep means healing is going poorly. In reality, sleep disruption is extremely common in the first several weeks after knee replacement. Your nervous system is adapting. Your body is healing. Your routines are disrupted. Large healing studies consistently show that functional improvements continue even when sleep is imperfect early on. So give yourself a break. Sleep quality often improves gradually as swelling decreases. Pain becomes more manageable, and confidence in movement grows. One of the most helpful mindset shifts is moving away from the idea of getting a full night's sleep and moving toward getting enough rest. Short naps, quiet rest periods, and a reduced pressure to sleep perfectly can lower stress and actually make sleep easier over time. It's also important to normalize restlessness. Tossing and turning does not mean you're damaging your knee. It means your body is searching for comfort. Gentle position changes are allowed and encouraged. You are not required to stay frozen in one position all night. In fact, I think that would be extremely uncomfortable. As healing progresses, sleep positions often become less restricted naturally. people gradually return to preferred positions as swelling decreases and tissues adapt. And there's no set timeline, and comparison to others rarely helps. If sleep remains severely disrupted beyond the early healing phase, that's worth discussing with your healthcare team. Sometimes medication adjustments, targeted pain management strategies, or addressing anxiety around sleep can make a clearly. Struggling with sleep after knee replacement does not mean you're doing something wrong. It means your body is healing from a major surgery. The goal is not perfect sleep. The goal is supported rest, patience with your body, and reassurance that discomfort at night does not define your overall healing. If you want to learn more about practical sleep strategies that support healing, remember I walk you through those in episode 3 of the Total Knee Success podcast. It's called Better Sleep Strategies After Knee Replacement: How Rest Fuels Healing and Recovery. I also want you to know that the Knee Replacement Game Plan, a comprehensive book designed to support smart preparation before knee replacement, is scheduled to be released in late 2025. And I'll be sharing more details as it gets closer. And you can always visit totalkneesuccess.com for the latest information and resources. In the next episode, episode 31, we're shifting gears and talking about a question that comes up for many people after surgery: home-based therapy, home-based physical therapy versus outpatient physical therapy. We'll talk about what the research shows, who tends to do well with each option, and how to make a decision that fits your body, your goals, and your life, not just a default recommendation. For now, if sleep feels hard, know that you're not alone, and this phase does pass, even if it doesn't feel like it at 3 a.m. This podcast is for educational purposes only. Discover more at totalkneesuccess.com, and be sure to subscribe and share, because every step forward takes you closer to living the life you love.